Good day, everybody, and thank you for being part of this conference, and thank you for being a part of this presentation on a very unique technology that has been around for a period of time now, but is actually the root of it goes back a long, long time in regards to dealing with the power of touch and the largest organ in the system, which is your skin. So before I get into further ado, we're going to enjoy this. Keep your questions through the email that will be left at the end of the presentation if you have any questions regarding what's been shared. But I think you're going to find this very, very intriguing in regards to what's possible with the skin and technology to help not only yourself, but the people that you care for as healthcare practitioners in the wonderful world of science and medicine. So here we go. Let's share the screen. Okay, so here we go. Move this to the side. Okay, so my name is Kevin Duguay. I'm a sports therapist by background, athletic therapist here in just north of Toronto, Ontario, in Canada. And I've now, my last 10 years, been involved in a very intriguing field of science with neurotechnology, neuroscience, functional neuromedicine, not only with this technology, but with a clinic that I work with here in Burlington, Ontario. And so when you look at the title of this topic, brainstem optimization with the use of haptic vibrotactile trigger technology, there's a lot of words here, but basically it's a technology, and I'm just going to show you here on the camera, is a technology. You can see this pattern right here on the camera. You can see it holding up in the slide deck, but this patch is a 5 centimeter by 5 centimeter patch. It has an adhesive backing that you will peel and stick onto your skin. And you're going to see what this does in regards to a beautiful part of our body called the brain, which is the master control center for every single system and function in the body. So here we go. Click. There we go. So my background stems now over 40 years in the area of professional athletics, amateur sport, teaching at the college level here in Canada. I worked about 4 or 5 years with the Canadian military, as you can see on the right-hand side. And in the bottom are some of the images of presentations I've been at with this tech. But in the middle is a clinic I'm working with here now in Burlington, Ontario, which is dealing with functional neuromedicine, functional neuroscience, energy medicine. And it's been a really interesting mix of blending these two technologies together, but we're going to focus on this haptic trigger technology that I share within the title and show you what is possible with a technology that is drug-free. Okay, so you remember this, drug-free technology to help optimize brainstem function. So here we go. So when we look at haptics and basically the power of touch, we understand from our infancy how powerful this sense is. And what we've learned at the end of the day is that the brain loves patterns. For example, how we get dressed in the morning, routines that we have every day. But the power of touch is a very big information network that is tied in with the nervous system. And this is what we've been able to take advantage of and utilize on a different setup in regards to this tech. So when we look at proprioception and touch and balance and how we're able to marry and bring together technology with touch to change and help optimize how the brain functions. So let me explain on this. So when we look at the skin and you start to get microscopic and we start to get very small, because most people look at this large organ on the outside of the body and they don't really understand what's involved with touch. And a simple analogy is of thinking people who are blind, how they're able to read by touch and picking up a pattern of bumps on a page. So it's very similar to this technology, but in a different way. And so we have these different structures integrated into the skin, sensitive to different receptors, sensitive to different aspects of touch, Could be pain, could be coarse, could be acute, could be cold, thermoreceptors, nociceptors, baroreceptors, proprioceptors. We've heard all these. There's over 30 different types of receptors in the body, which is continually feeding information here to keep us working at 100% or as close to it as possible. So we're using the sensory nervous system, okay, to bring information to the brain and allow it to do something a little bit different with the information that it picks up through touch. I'm going to have a video here in a little bit. It's going to explain a little bit more detail to simplify it, but there's a lot of science behind this. I don't have time for it in this call, but I think you get the nuts and bolts of it as we go through. So what we've learned through the power of touch, or haptics, is the brainstem, CNS processes this touch, integrates, as you can see with the PowerPoint, distributes information based on receptors, and it carries it through this autonomic somatic nervous system to the brain, where it's decoded. Because think of it, it's touch, physical touch, nervous system, decoded. What did I just touch? And we build up this pattern recognition that for example, if I put something in your hand with your eyes closed, and I ask you to put out your hand like this, and I put something in your hand with your eyes closed, and you closed your hand on it and ask you what it is in your hand, most people will identify it. They go, how'd you feel it? Through touch. Brain recognizes the pattern. So this is what we're using through the science. And so what we saw is in this area of these neural pathways, we were able to use this technology through different patterns. You're going to see this in a second. And it has some pretty profound effects on what you see here on this slide. So when you look at these components to our everyday life, these are big issues dealing with 80% of visits to the physician are for low energy, chronic pain, and poor sleep. We're going to talk about two of those. We're going to talk about sleep, and we're going to talk about pain. And I'm going to show you a video of how we affect the change on balance, stability, posture. Okay, for example, with this tech, using the peripheral nervous system with a pattern, and you'll see with your own eyes how fast this can work. And again, to get your understanding of the power of haptics and touch. So one of the things that you can use, and we've seen this in the clinic, is using QEEG brain mapping to look at how is the brain functioning. All the different networks, the Brodmann areas, for example, how is the brain communicating? How is it processing? How is it relaying information? Is everything working in synchronicity, as we call it, this synergy in the brain? But we've learned that there are times where the brain is affected, it's disrupted, it's not functioning properly. So this is quantifiable. You can measure this. And if you look at the imaging here from right to left, I want you, in layman's terms, the picture on the left is your brain in a traffic jam. Your brain on the right is on the beach. So when I explain this to people in the clinic, I says, where would you rather be, in a traffic jam or on the beach? It's always the right answer. It's like, Kev, if you can help me get to that right side, that image we see in QEEG brain mapping, this would be a good place to be, because this is the brain that's functioning optimally. And when it's not, we see the different signs and symptoms that our clients and our patients come to us in an assessment where the nervous system has been dysregulated. It's not functioning to where it needs to be. So that term you see on the left called homeostasis, we remember this as the balance. And the body's always striving to find this balance in the body. Blood pressure, temperature, pH balance, enzymes, blood work, all these components that we test. It's like, I got to stay in the zone, Kev. Can you help me stay in the zone? Because I'm either hyper or hypo. I want to be in an optimal position. So what we've learned here with this technology, with this super patch, is how it's branded. And it's like, how it's branded is that you look at the top bullet, every bodily function has a neural code. There's a neural code, okay? The nervous system runs everything. So when I talk to all my neurologists and all my therapists, I go, what's the first system formed in the womb? It's the nervous system. Then I asked my kids, I said, if the nervous system is the first system formed in the womb, It must be the most, I'll get the right answer, important. So this is what we function, this is what we target. We help the most important system in the body, which orchestrates and runs every single process in the body, because the body's trying to achieve a state of homeostasis all the time, to run optimally. So you can see as you follow the bullet points, codes, damage or affected for multiple reasons, sickness, illness, nutrition, stress, injury, multiple factors. And what we've learned is we can help literally reset or optimize with these different codes, which you'll see more in the video. So I'm going to play this video. It's 90 seconds long, but it does a very good job of explaining in a nutshell how this tech works through touch. And again, I iterate this very, very strongly. There are no drugs involved. There's no side effects. There's no chemicals. There's an adhesive on the patch, medical grade adhesive, but there's no drugs and there's no side effects, and it's age safe. So it's profound. Okay, so here we go. Enjoy the video.
Super Patch is the most advanced wearable technology in the market, with 15 plus years of research and development. Super Patches are 100% drug-free, non-invasive, and backed by science. Our skin absorbs and transmits information from many different types of stimulation. Every physical, emotional, and psychological function has a corresponding neural code or message in our brain that controls and regulates it. Due to factors such as injury, stress, genetics, etc., these neural codes can get disrupted, leading to poor health, wellness, and performance. At Super Patch, we've decoded these neural messages that manage the neural control of physical, emotional, and psychological functions. Every single Super Patch has a unique pattern of ridges in it, similar to a QR code. When these ridges come in contact with our skin, the receptors in and around our skin send a message to our brain, which then decodes it. This intricate pattern of ridges is known as Vibrotactile technology, or VTT for short. When the patch stimulates the skin receptors, it generates and sends a very complex signal to our brain to correct the specific neural codes that may be disrupted. The effects are almost immediate. So you focus less on overcoming wellness and quality of life challenges and more on living a happier and healthier life. Whether it's improving your sleep, enhancing your sports performance, or unlocking other life-enhancing benefits, Super Patch has you covered. Try Super Patch today and start your health and wellness journey. www.
Okay. So when you see this, let me just back up here. So this is very profound. It's something as simple as a patch, and you can see here, this is the inventor of the technology, Jay Dhaliwal in the background, and you can see the size of the patch. It's 5 by 5 centimeter patch. You can see the ridges, and this is what we've learned, he's learned, and he shared, and what we've used and experienced in regards. So let me get into a couple of papers here in regards to the science side, okay? So this was a paper that was published, okay, peer-reviewed in a Journal of Anesthesia and Pain Research. But here's a couple really fascinating things about this study, okay? And I just want to bring everything how profound this is. Again, drug-free, non-invasive, simple, easy, effective, cost-affordable adhesive patch. January of 23, this study gets officially released, and the organization with Clarity Science in Rhode Island, which did the paper, shared some of the findings to us as a collective group that we're using part of this different variation of this tech in our practices and in our work with our people. And they were dumbfounded. Because again, we look at the options we have for dealing with pain. And there's lots of different ways we can deal with pain. I can't stress enough, this is a non-pharmacological option for people. So I let people decide. As a physician, as a healthcare practitioner, I'm always looking for options for my clients, that what's an easier, safer way that I can help with pain. And so we were selected in October of 23. Paper gets released in January of 23. October 23, we get selected to present at the World Congress of World Institute of Pain in Turkey because of the findings of what this patch provides. And this is the patch. It's called the Freedom Patch. Welcome to freedom from pain. Okay. And so here's just some of the Cole's notes versions from the study, just for the simplicity of the presentation. You can get the full study yourself. You saw the title, but if you look at the numbers on the screen, this is what shocked the people who did the study, because it's not a small group of people. It's a large demographic in the study. That you look at day 7 and day 8, what they noticed about their pain. And again, we know as practitioners, we know how pain affects quality of life. It can be debilitating. Because, Kev, can you help me with my pain? We know there's different options. It says, here's an option. And so the conclusion and part of the study was, has incredible potential to be added to the current arsenal of non-invasive and non-pharmacological pain therapies. That's it. So what we learned for people is that try it. Do your own experiment with your own body and let me know what happens to your pain. It doesn't matter the source of the pain. We're looking to help them with that in their quality of life. Another one that was published is dealing with sleep. Okay, it's called the REM patch. Again, it's a different pattern. All these different patches, these 5 by 5 centimeter patches, have a different pattern. They give us a different code. Okay. And for those of us who are working with people that have sleep challenges, we meet a lot of them here in North America. We're looking at what are the options to help people sleep better. Because for those of us who work with people that are sleep challenged, we understand what's supposed to happen to the body when you sleep, with REM sleep and deep sleep. So if there was a way that we could help you with those sleep networks, and if you look at the points in regards to the options that are out there, again, all it is an option going, Kev, you've got a drug-free option to help with pain. Okay, this is what we bring to the table. So you can read the points, you can stop the video. I'm not going to read through all this. You guys know how to read, but this is what we look at. So reduce time to fall asleep and increase hours of sleep, enhance overall sleep quality. Okay, this is very profound. So what do we offer with this technology? So when you look at this bullet list on the left-hand side, when we share this with our clients, they go, can I try this? Because of the bullets you see on the left-hand side. And what we've learned is when you can show them something that doesn't require like a major lifestyle change, the compliance rates go up. And I've learned this as a therapist in 40 years. The more complicated the procedures, typically the harder it is to follow. The simpler it is, the easier it is to stay proactive with the approach to deal with whatever challenge that you're working with. And so the people that we meet on the clinical side, when you look at the 3 points, and I'm not going to read all this because it's just for the time, but if you look at some of these 3 categories of what people are looking for, whether you're a child, whether you're an athlete, whether you're you've injured yourself, you're a senior citizen. I'm going to show you a couple of videos here in a second of how powerful this is in regards to affecting of change on the CNS through the power of touch. Okay, so you can figure out for yourself when you look at these 3 metrics going, this is very powerful, Kev. Okay, welcome to science. We're always learning in the world of health and wellness and medicine. And so again, looking at different patterns, all they are different patches that have different codes that optimize different neurological networks that deal with specific symptoms. Okay, so we're looking at signs and symptoms. So we're looking at liberty for balance, freedom for pain, focus for cognitive, REM for sleep, victory for athletes. Just a quick nutshell, okay, in regards to it. So I wanted to, just from a time perspective, I want to show you what is capable with the CNS through this tech, through a couple of stability demonstrations. Okay, so Obviously, this is a senior citizen. I'm a senior citizen. I'm 63 years old. And I want you to show what happens, what can happen with a brain that you saw with that brain map that is not optimized. And all of a sudden, a patch goes on and instantly optimizes brainstem function. We understand the benefits of brainstem function, balance, power. So watch this with this senior in regards to what she's capable with her balance. Then the tech, you're going to see me on the right side. I'm going to apply this patch to her arm. I'm going to do the same demonstration again. Watch the difference in her balance and stability. Okay, so here we go. Left side, no technology, what she knows. And she's, you know, again, a lot of seniors struggle. And we know a big thing with seniors is what? Fall prevention. We know the statistics with fall prevention. So here we go. Okay, stop talking, Kevin. Play the video. Here's my mouse. Here we go. Okay, here we go. Okay. So this is dynamic stability. Okay. Okay. We know with feet together, a lot of seniors don't like this. They don't have a lot of stability. So they like the feet wide apart. So what we do here is we put feet together, try to stand tall like a tree. We go fist over fist. And I am slowly going to push down on her fists. I want her to wrist. Watch how easy it is for me to disturb her balance. I push down, boom, she's gone. She's right off midline. Okay, so I do it again. Yes, I know she's got a bit of a forward lean. That's her body, and she's got no balance. That's her, as I say, neurologically in a traffic jam. Now we're going to put the patch on her right. It doesn't matter where you put it, right arm, left arm, doesn't matter, but arm is very simple for the practical guide. I'm going to just pause the video here. Actually, I'll play it because I want to listen to her expression at the end. Watch the difference in her power. I'm 5'10", 170 pounds. Okay, and here we go. Okay. We're going to do it again. Same demonstration. Feet together, fist over fist. Watch what happens with her core power because of an optimized brainstem. I'm hanging on her and she doesn't move.
I almost beat you.
Okay, so she goes, I almost beat you. When I share this tech with my seniors, they often cry because they cannot believe the change in their balance and stability with a simple patch. But again, the patch optimizes brainstem function. The next one I'm going to show you is dealing with an athlete. So look at the difference. So this is a personal trainer. This is in Florida. We're going to do a lateral stability. Okay. So again, just to walk you through it quickly from a time, it's feet apart, shoulder width apart, standing tall, shoulder tight, elbow lock, make a fist, wrist lock. And I'm going to be pulling up on his fist. I want him to resist me. That's all it is. I'm just generating a force, almost like muscle testing. And I'm going to slowly apply a vertical force. I want him to resist me. Don't let me move you. Watch what happens to him. And then watch what happens when the tech is applied to his arm. Okay, so here we go. Okay, so again, fist, make a fist, wrist tight, elbow tight, shoulder tight, feet shoulder width apart. I apply vertical force. Okay, he's a big boy. Okay, and up we go, and there he goes. Very easy to move him. He's got more muscles than I can shake a stick at, but neurologically, I know where he's at. So I do it again, and I disturb his balance. Very easy. Now the tech goes on the arm, same as the senior. Watch the difference. Okay. So we apply the tech. Brain is optimized with our studies, on average, 30% improvement in brainstem function. Watch the difference in his power. Okay, same demonstration. I apply force vertically, and he doesn't move. This happens every single time. Nervous system is a nervous system is a nervous system. Okay. So what we have, as we began to grow this and share this, we had a lot of practitioners like myself that were looking at, you know what, this is a pretty cool option to add to my clinic. Why? Because I'm dealing with neuromuscular, musculoskeletal, neurological, I call it neurological inconveniences. I don't care what condition you have. I've seen a lot in this journey with this tech. But the demo you saw with the senior and that personal trainer, that happens every time. Doesn't matter who you got in front of you. That's the difference with the power and stability. That's the beauty of a brain that is optimized, and that's what we figured out with this code. So on that note, I'm just over 20 minutes, and I want to be respectful for that, for the time. I know there's a lot here. Back on this slide here, there is a healthcare practitioner program that we have for the people that are in this field. Why? I'm always looking for options that I can bring into my clinic, that I can share with my clients to help them on a what? The road to recovery. 40 years of sports med, pro sports, amateur, everything in between. It was always about what? Helping people. So if I could help you manage your pain, if I could help you sleep better, if I could help optimize your balance and stability, is that of interest to you? Absolutely, Kev. What do you got? I have this. So again, it's a technology that uses pattern recognition through haptics. And I'll just bring it up on the screen. This is the freedom patch. You can see the ridges. Okay, it's very, very faint, but there are ridges in this patch, and your PNS is so sensitive, picks up the pattern. Where's it processed? In the brain. What does it do? Optimizes the pain network so they can deal what? Manage your pain. Now you start to understand. So for all of you that are intrigued by this, like I was, that demo that you saw on the screen was my turning point as a therapist, because I thought I knew everything about balance and stability, and I could not pass that demo. And when I share this with my clients, no matter what age, no matter what challenge they're dealing with, and I put on that, the patch that you saw in the video was this one here. It's called the Liberty patch. It's a different pattern. It's a different pattern. That pattern targets what? Brainstem. That's the difference that happens. And it happens what? Every single time. That's the beauty of this tech. So if you're intrigued and you're curious and going, Kev, you don't talk like all their doctors. I'm not a doctor. I'm a sports therapist, I'm an athletic therapist, neuro wellness specialist. This is what I do. I talk real language for people because my clients that come to us, Kev, can you explain neurology in English for me, please? Because I know I got a problem and I'm looking for answers, and I heard about you guys as practitioners. What's out there? And again, you saw with that list, drug-free, non-invasive, simple, easy, affordable. It's what the world needs. There's a lot of hurting people out there. So if this has touched you in the heart and kind of intrigued your brain, going, I can't believe what I just saw, Kev. I'm happy to have a conversation with those of you that are curious about this. That's all. Well, I tell you what, when that paper was published in Turkey at the World Congress Institute of Pain, there are a lot of heads turning going, are you kidding me? You guys got a patch that helps with pain without side effects? Yeah, that's what this is about. That's the beauty of this. That's why it's so profound. So on that note, thank you for listening, watching, learning. And again, this is my email. I'm about an hour's north of Toronto, Ontario, and Canada. And if you want to learn more, reach out. I am more than happy to share about what we're doing. And I believe now this tech is in like 38 countries. Okay, it's in 38 countries now where this tech is part of the options for us as healthcare practitioners. So let me stop the share. Stop the share. And let me stop the recording.